for the doctors, where we share experiences, knowledge, and journeys of successful medical practitioners. And today we have Dr. Shakti with us. With his exceptional knowledge and experience of being a head and neck oncologist, he is here to discuss about his journey. How did he, land up into after his MDS into being a specialist into oncology? How is he training new doctors now, promoting them to get into oncology and to understand the scope and opportunities into it? So he's here to discuss about everything about the opportunities, the scope, and the wonderful journey of of being an oncologist. Welcome, doctor, to the platform. It's really nice to have you here.
Thank you, Dr. Ayesha. Thank you for inviting me.
So, sir, let's start firstly with your journey. How did how did you get into being an oncologist? How was your journey? Who guided you to get into this field?
Okay. So when I was doing my master's in maxillofacial surgery, so my guide, Dr. S.V. Kumarswamy, he was the first oncologist or oncosurgeon from MaxPac background. He has an experience of more than 45 years. He did his master's in 1972. So I was fortunate enough to get trained under a person like Dr. S.V. Kumarswamy, probably my mentor, my guide, my teacher, and everything. Today, whatever I owe, I think it is because of Dr. S.V. Kumarswamy. She was the one person who has ignited, about oncology in my heart, that I should be practicing oncology in coming future. And then things fall into my place and I could reach into field of oncology. So once I did my masters, I always had in mind that I have to do oncology. So जिसको कहते हैं ना कि जब आप किसी चीज को तहे दिल से चाहते हो तो पूरा सारा जहान लग जाता है आपको वो चीज दिलाने के लिए।
सही बात।
तो ऐसा ही कुछ हुआ था हमारे साथ। After I passed out my MDS, I joined a medical college and I joined as an assistant professor. I was in a department of maxillofacial surgery, but back of the mind, my training for oncology was due. And then the opportunity comes from Dr. Dubey, who is my friend, my senior, and I had been to Patna from Mahavir Cancer Sansthan. I did my training in head and neck oncology, and from there the journey of oncology have been started for me.
Great. That's very interesting, and I'm sure mentors play a very important role, in growth, especially medicine. Everybody will relate that mentors are the best people to guide you in the right direction.
Right, Aisha.
Yes. So now, and you are also being on that part now, guiding so many students in the right track and helping them to understand about this field. So let's start for the MDS, postgraduates, because you started your journey into oncology after your post-graduation. So how do you suggest people who are into, OMFS, oral maxillofacial surgeons, how is it easy for them to get into oncology? What are the kind of scope that they can look forward to if they want to get into this branch?
Okay, so now I think the maxillofacial surgery has developed and it has raised the horizons to a different level.
Correct.
So your maxillofacial surgery, it allows you to practice pure oncology, in the coming future. So what we need to do is we need to subspecialize.
Yes.
We need to create our own subspecialization because the DCI stops when it comes to education at maxillofacial surgery. Unfortunately, we do not have a super specialization in the field of dentistry because they say dentistry itself is a specialty. So if we are doing MDS, it is a super specialization in terms of the DCI documentation. So unfortunately, we do not have any super specialization from the DCI point of view.
Yes.
But it is our will. We need to make our sub specialization. You can say sub specialization or super specialization. Now, as I have chosen myself into the field of oncology, so MDS, after MDS, you get opportunity to get into the field of cleft and craniofacial, you get into field of oncology, you get into the field of, there are 2, 3 fields where you can choose to work. You can choose to work as a basic maxillofacial surgeon also. So now I'm going to talk about how the oncology per se can be pursued by a maxillofacial surgeon.
Okay.
In last couple of years, I think with the number of people getting trained into oncology, now the FHNO gives us a platform to get training into oncology. There are various fellowships are available. There are various observerships are available from FHNO as well as from the AMSI, that is Association of Maxillofacial Surgeons of India. But only thing what I want to mention here, Ayushi, that if somebody wants to get training in oncology, then they should eat oncology, they should drink oncology, they should sleep oncology.
Okay.
It cannot be done as a part time. कि चलो ठीक है थोड़े दिन oncology सीखते हैं. If that attitude, you are not going to be successful any day in field of oncology, because oncology requires your passion, your dedication, your hard work, your willingness to give another 3 years.
Correct. Correct.
So it's a long journey, and the people need to clear in their mind that it is going to be a tough task. It's not going to be easy. But at the end of the day, you will be recognized as a super specialist in field of oncology.
Correct. Correct.
Yeah.
This is so correctly said, because it's such a deep branch that, to work hard into it is very important. So now if somebody wants to go into it, what are the kind of trainings they can, go forward, how to train themselves? Because it's a super specialization, as you mentioned. OMFS includes so many things, and during your post-graduation, you learn so many things, small. So if somebody wants to get deep into oncology and only want to learn about it and go further, what is your suggestion to them?
Okay, so once you finish your MDS, it is mandatory to do an observership. So people confuse their onco postings with observership.
Okay.
So I want to make it very clear. Your experience in oncology starts after your MDS degree is done.
Okay.
My boss used to say, Ayushi, that once you have done your MDS, you are fit to learn surgery. You're getting my point?
Yes, I'm getting my point.
Doing MDS is a basic requirement to learn surgery, and that is what he used to say. After an MDS, you are fit to learn surgery. Because there is something called as the surgical craft, which develops after your practice is started. Yes. It's not during your masters. It is just masters is a foundation. Now you need to build upon it, and when you try to build upon it, it requires, as I said, a lot of hard work to develop the surgical craft. Now, once you are done with your MDS, you need to do the observership program. So you need to associate with the good hospitals, go see them, what they are doing, how they are doing. Cancer hota kya hai?
Yes.
Cancer is not surgery. Now let me make it one more thing very clear. Cancer surgeon doesn't mean cut or cutting. If you are cutting, that means you are a surgeon. No, you are wrong. A surgeon should have a very good understanding of systemic management of the patient.
Okay.
When you operate a patient, you should know in and out about the general physiology, the general condition of the patient, and the management. Do not rely every time मेरा physician देखेगा, मेरा वो देखेगा, मेरा काम सिर्फ काटना है. No, that's a wrong attitude we as a surgeon have. So what you need to learn in after MDS in your observership is the basic management of a patient. Managing in patients on a systemic basis. Okay. If a patient has got a renal disease, if a patient have after surgery renal issues, how do you address? So there are various things you learn when you are in observership. Importantly, you learn whether this field is fit for you or not. Because when you do observership, and that is a basic requirement for any fellowship.
Correct.
If you want to apply for any fellowship, what they ask is, give us 6 months of observership program, because observership program will give you, you know, it's like they will give you an insight that whether this training is appropriate for me or not, because we don't want to waste our energy in teaching a person who spends time with us for 2 years and again he starts his implant practice or the impaction practice.
Correct.
So it is a losing situation for both of us. It's for, we have taught a person who is not practicing oncology, and that person has given his time and not practicing oncology.
Yes.
So this 6 months period is a fit in time. Whether you are fit to learn oncology, if your if your heart says yes, you should get into oncology. If your heart, if your family, if your personal issues, social issues do not allow you, then please do not step into oncology. Waste your time, energy, and your the interest of the teaching person also.
Yes.
So after your MDS, you should do observership of 6 months. That is the basic thing you should be doing it.
Correct. Correct.
Yeah.
Very correctly said. And this is nice to know. That at least you get 6 months to understand if you want to get deep into it or not. This is the best thing to understand. So now, if there is somebody who is very clear and very determined to go deep into it, complete 2 years of trainings, and and then what is, firstly, when you mention trainings, what are the best places to get trained for? This is also something that people normally look forward.
Okay, so now there are, as I said, there are various training institutes are available. There are various fellowships are available from AMSI. There are I think 8 or 10 centers through which AMSI offers a fellowship program in oral oncology and reconstructive surgery.
Okay.
So there is an exam for that. You need to write an exam, clear that exam, and you need to attend that particular session. I mean, you need to attend that particular institute for 1.5 to 2 years.
Okay.
Secondly, the FHNO, that is from the the Federation of Head and Neck Oncology, that is an oncology association in India, that also allows you to practice, I mean, to learn oncology from various institutes across India.
Okay.
Then there are institutional fellowships.
Okay.
Like the institution offers you the fellowship, like my institute offers a fellowship in head and neck oncology for 2 years program. So we take individual basis, we select the candidate, we train them. Right now, Dr. Sudeep Srivastav is with me since last, he's almost completing his 8 months. So we are going to take the next candidate in coming to 22, I mean, in the year of 2022. So every institute, there are various institutes who offer individual fellowship programs. So like how my institute, there is a Narayana hospital, there's a Kidwai hospital, there is a ADR in Chennai. So we have a list of hospitals where every year minimum of more than 50 fellowships, more than 50 candidates can apply for these kind of fellowships.
Okay.
So out of probably the 1,000 or 500 MDS passing out every year, the 50 people can apply for these kind of fellowships. So we can guide them that which institute is good for you, which institute offers what, how you can get the training. That I'm always there. If anyone have any doubt, any guidance regarding, once their mind is clear that yes, I want to get into oncology, then I think I will be the best person to guide you into how you should put your feet into the field of oncology, because we have gone through the same path. Now at least we know what is right, what is wrong, and how to reach to that level.
I can completely agree. It you understand that by experience, and so you are the best person to understand it in depth. You have been into this for so many years now. So now, understanding about the training, post training, what are the kind of job opportunities these kind of super specialists can look forward to? Discussing so that people have things very clear for their future. They can understand what is coming up for them if they get into it.
Okay, so now this is the most common question which we face from the candidates. Sir, इसके बाद हमारा क्या future है? Exactly. So that has been question been asked many times to us.
Yes.
Now I tell you, Aishi, we need to create our destiny.
Okay.
We cannot expect anyone to write destiny for us.
Yes.
We need to create our space by our skill, our knowledge,
Yes.
our passion, our dedication.
Yes.
No hospital, you cannot expect like how the teaching job in the hospital, the dental colleges. Earlier, people used to do MDS and they had कि चलो मैं pass out होके I will join a dental college.
Yes.
But now that is gone. So that is how do not expect any hospital to hire you and give you the money or to give you the remuneration. Rather, what I would like here is their own space in the market.
Yes.
Everyone should try to work as a team. I also would want that people whosoever train.
Sir, your
Okay.
video has stopped. Yes.
Yeah, I don't know how it stopped. Okay. So now you need to create your own destiny. See, job opportunities are created on your skills. And when you get so much highly skilled, people ask for you. Frankly speaking, I have not thought of what I'm going to do after my fellowship training, but things went in place. Everything came as I was moving ahead, and things were coming which even I have not expected. I mean, positive way. And today I'm at a place. I hospital offers me the job, but I deny it.
Yes.
I say I don't want to join you because I have my own space. I want to create my own identity, and that is what I expect everyone to do it. I can tell you the ways. You have got such a huge base. There are, when it comes to oncology, you will not have dearth of patients. You will not have any competition if you are competent enough in your work. There's no competition for good work, Ayushi. If you know good work, you do not require anyone to judge you कि ये अच्छा काम करता है, इसको जॉब देनी चाहिए या इसको जॉब नहीं देनी चाहिए. If you do good job, you will get your work. Important, do not lose hope. And if you still have any doubts, you should work as a team. You can associate yourself with the operating surgeon, with a team, and start working till you get your identity. Your work is appreciated. You develop the skills, and we are there for you. I can help anyone who wants to work with us. I can guide them in any way they are wanting it.
That's very nice to know, and thank you so much, sir, for that help.
Yeah.
So now, it's nice to understand a part of dentistry that is full of work, and like you mentioned, no dearth of patience is a big thing when it comes to dentistry. So now, understanding the different kind of job opportunities, what is the kind of pay scale a postgraduate who enters into it can look forward?
Okay, as I said, when I talk about pay scale,
yes,
you are not going to get a job.
Okay.
Once you are trained, you should start doing surgery, whether under supervision of somebody or if you're confident, you can do your independent surgery. A cancer surgery will cost around 1.5 to 2 lakhs, where a surgeon fees, if for single operating patient, a surgeon fees is more than 50,000 rupees. It depends on you how much you want to earn.
Yes.
You want to earn 5 lakhs, you do to 10 cases. If you want to earn 1 lakh, just do 2 cases. So it depends on your preservation, how much you want to develop yourself. This, as I said, do not look for a job कि मेरे को कोई 1 लाख रुपए दे, मैं बस सुबह शाम ये काम करूं और घर चला जाऊं. Do not look for a job. Look for enhancing, sharpening your skills. Money will flow into it. I tell you my example, Ayushi. After if I mention my journey, you will understand. I did 4 years, around 3.5 years of practice in a government job. I left my government job. I was with a government job. Government was happy with me. They were paying me well. I had my private practice. I was all alone at my practice. I used to earn a hefty amount after my 2 years of practice. Everything was there. But somewhere my heart says, no, 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 I don't need money right now. Once you get into the cycle of money, you will lose your passion.
Yes. Yes.
After 3.5 years, I left everything.
Hmm.
I have resigned from my government job. I went to Patna. I
Hmm.
paid a fees of 1 lakh rupees for training.
Okay.
My stipend was zero.
Okay. Hmm.
We were not paid any stipend. Almost for 1.5 years, we worked for free.
Hmm.
And that is after 3.5 years of
Practice.
passing out my masters.
Yes. Yes. Hmm.
After I finished my 1.5 year of training, then I became a resident doctor there.
Hmm.
I was paid 35,000 rupees for 1 year, almost for 6 months.
Hmm.
35,000 rupees, which probably a senior lecturer will get in any of the college.
Hmm. Correct.
After my residency for 6 months, I have joined HCG Cancer Center for 15. They used to pay me 45,000 rupees. So I'm talking about the remuneration because you asked how much money you get. I have never see what I'm getting it, but I was developing myself from inside. I knew it. What I am learning today will pay me back. After my HCG, 1 year of tenure at HCG, and this last 5 years, probably the earnings, what I have lost in that 3 years, I have earned 5 times of what I have earned in those 3 years.
Yes.
Am I earning that? So its earning is different. Again, I say
Hmm.
it just follows, but stick on to a passion. Money will come. लोग कहते हैं ना कि पैसा तो बाय प्रोडक्ट है. It's a fact. I'm telling you,
Yes.
money is a byproduct of your skill. If you're doing good job, you will get money.
Yes.
So do not look for a job. Look for sharpening your skills. आपका स्किल ऐसा होना चाहिए. And I tell you, we have seen it कि whatever, if we sharpen our skills, if we develop ourselves, there is no competition to us. After a time, nobody sees your degree कि आप MCH हो, आप MDS हो, आप क्या हो. They see your attitude, your approach, your confidence, and your skill to get operated. So that is what a message I want to give. Develop those things which you will not get even if you spend lakhs of rupees. आप किसी को दो कि मुझे confidence, ये 10 लाख रुपए लो, मुझे confidence दे दो. Nobody is going to give you. That you have
Especially
to
not for a
develop
surgeon.
over a period of time.
Yes, yes, yes. No, no, I completely agree. Completely agree. So the idea of asking this question was people actually has this question in their mind, how much is the money earning after that. So that is the reason, we
There's no limit. I tell you, Ayush, there's no limit.
I can agree. Yes.
You can go to extent of earning 15 lakhs a month. If I tell you in the figures,
Yes.
because we have done it.
Yes.
You can earn 15 lakhs a month. That is, what MDS cannot expect from, and that too I'm telling from your practice,
Correct.
not from the other sources, from purely your practice.
Yes.
So you can get money. There's no doubt.
Yes. No, no, very nice to know. So now this is for the MDS. Now understanding this for the the graduates. BDS, after BDS, is there a scope, anything that people can get into oncology? Something I agree, there is in graduation, there is very little, exposure of surgery and anything of that. So do you think that graduates can also do something, or they have to do their post graduation to make a base? What is your suggestion?
It's a nice question. I appreciate the question, Ayushi. So now, see, people need to understand
Yes.
oral cancer belongs to the field of, when it comes to oral cancer, if I say,
Hmm.
when it comes to oral cancer, I'm telling you, we people, when I say we, I belong to the family of dentistry.
Yes.
We have a role to play, and that too a crucial role to play in every step of oral cancer management.
Correct.
Now I tell you how.
Hmm.
Number one, when it comes to prevention, Dentists are the first people who get to know whether this patient is having habit or not. Patient कितना भी छुपाना चाहेगा, नहीं मैं तो नहीं खाता हूँ. We are smart people. Within a fraction of second, we can make out you eat gutka, you eat supari, you smoke.
Yes.
So we are smart people. We can work on prevention. So now how we can work on prevention? We need to aware the people about ill effects of tobacco. We need to tell, see boss, this tobacco will cause damage today or tomorrow.
Yes.
It's not to you, but to your family also. Second, we know we can help people in quitting the tobacco. There are many people who say, "Sab chhodna chahta hu, chhutta nahi." But I think as a doctor, if you try to counsel him once, twice, thrice, they tend to leave the habit or they tend to decrease the amount of consumption they are doing it. So prevention can be done only by a dental surgeon. Nobody will, no physician, no surgeon, no ophthalmologist, no orthopedic will counsel a patient for tobacco cessation or breaking the habit of tobacco. You agree with me or not?
I agree. Completely agree.
Completely agree. Second, now, early detection. Now we have been read about oral medicine right from our third year. हम सब ने बर्किट पढ़ी है, oral medicine. We had only इतना सा small portion we have read of thousands and thousand pages.
Yes.
But sometimes we forget all those things.
Yes.
Our mind ultimately it just comes to tooth, implant, RCT, capping. No, we need to open our horizon, what we have learned in third year. It's not the treat, we should not only treat the tooth, it's the oral health. It is the oral cavity per se, we need to look for it. We can diagnose this early patients of cancer. Cancer doesn't happen overnight. कि साहब सुबह उठे छाला हो गया उसमें कैंसर हो गया. No, God is kind to the people. God is kind to us. God always gives a chance कि आपको ये तकलीफ है आप इसका ट्रीटमेंट करा लो. Oral cancer is always preceded by precancerous lesions, and we have read it. We have cleared the exam of oral medicine, and everyone should, or they have to agree with me that it's a fact. Oral cancer is always preceded by precancerous lesions.
Yes.
We are the people who can see those lesions.
Yes.
What is leukoplakia, erythroplakia, leukoerythroplakia, lichen planus, pemphigus, hundreds of diseases in oral cavity.
Yes.
But when a patient comes with tooth pain, we just say RCT karana padega, cap karana padega. Forget there's a lesion on the other side. That is where we are going wrong. We as a dental surgeon can detect precancer lesions or also the early lesions of oral cancer. My boss Kumar Swami always used to say, if you want to treat cancer, you treat stage 1, stage 2 cancers. Not only treat, go look for those cancers, find out those cancers and treat them. We cannot become God to save advanced stage cancers or stage 4 cancers. We cannot become God. Whatever we do, the prognosis is always a question mark. But what we can do, we can early detect these cases. We can treat these cases and give them a good quality of life.
Correct.
Third is the treatment. When it comes to treatment, treatment is divided into 3 phases. It's surgical, radiotherapy and chemotherapy.
Okay.
So now a surgery is just a small portion of oral cancer management, and where a maxillofacial surgeon, an ENT surgeon, a general surgeon, an MCS surgical oncologist, there are so many people are involved in the surgical phase. That is a treatment phase. Then comes the follow-up phase. A patient always has to be on follow-up because patient had a habit of gutka. That is the reason he has developed oral cancer.
Hmm.
We have read about something called as field cancerization.
Hmm.
When a patient eats tobacco, whole oral cavity is prone for oral cancer. We
Okay.
have done on one side, he might develop on other side.
Okay.
So we need to keep the patient under follow-up, strict follow-up for next 2 years.
Okay.
So follow-up has to be done by a dental surgeon.
Hmm.
Number five is the rehabilitation. Now, every cancer patient, there are more than 50% of teeth they goes in the vicinity of cancer resection.
Hmm.
These patients, most of these patients are on liquid diet after cancer surgery.
Okay.
They have a poor quality of life.
Hmm.
And probably I feel that is the reason that people fear the surgical fear they have about the cancer. I mean, the fear they have about cancer is the surgical fear.
Correct.
कि कैंसर के ऑपरेशन के बाद में मैं खाना पीना नहीं खा सकूंगा. I have to be on liquid diet throughout the life.
Hmm.
I do not have teeth on this side. मैं कैसे जीऊंगा? And there are many things associated with that.
Correct.
So they have got a poor quality of life.
Hmm.
Who can replace this teeth?
Doctor.
It's only we people can replace the teeth. Now, as a dental professional, you need to understand that a dental professionals are involved at prevention, early detection, treatment, follow-up, and rehabilitation. It is important aspect to understand for us,
Hmm.
but I think we are not giving us even 1%.
Correct.
So that is where our talk today revolve around this field of being dental professionals. They should actively participate in the in the comprehensive management of oral cancers.
Yes.
Yeah.
That's completely true. So, listening to you took back to my college years when we used to see so many precancerous lesions, and and that's completely true. Post college focus gets very different, and you start focusing more on practice. And correctly
Right.
said, this is something that every dentist should focus on now, because cancers being increasing in the society, we are the best people to do that. So rightly said. So now we have multiple questions also for you, sir. So because you have also done fellowships in different parts of the world, and you have been as an observer also. So how was your experience there? How did you apply to different universities internationally? Something for these dental students who want to do that, who want to do observership, and understanding how to go forward with this.
Okay. So before I get into your question, what I would like to mention here is
Hmm.
no dental college
Hmm.
teaches us about this.
Okay.
And I am working with a foundation called Asian Head Neck Cancer Foundation.
Yes.
We have taken an initiative
Hmm.
of empowering dental professionals.
Hmm.
We have started a project or a education program by name EduCan, that is Education for Cancer. We have taken this initiative to train our people
Hmm.
to have their mind open up for oral cancer management.
Hmm.
So this program is divided into three modules: module 1, module 2, and module 3,
Hmm.
wherein what we are doing is we are training. In module 1 we are talking about the prevention and early detection.
Hmm.
So more than teaching, it is all about refreshing, brushing up whatever you have read. It is just we are trying to change your approach. You have just put, जैसे वो घोड़े के लगाते हैं ना, आपने वैसे लगा रखे. You are not seeing others outside of that. So we are just trying to take out those.
Hmm.
Open your mind towards oral cavity. Open your minds toward oral cancer.
Hmm.
So module 2 is all about how to take a biopsy. Now every dental surgeon should be empowered to take a biopsy.
Yes.
But they think मेरे करने से क्या फायदा, मैं क्यों बायोप्सी लूं, कहीं ब्लीडिंग ना हो जाए, कहीं बीमारी ना फैल जाए. Their low confidence is visible in the patient's eyes. Patient भी बोलता है नहीं साहब आप तो मत ही करो. So I think that is where we need to empower. जब आप किसी की biopsy करके patient को बोलते हो कि see boss, you have got a early cancer, get the treatment done. Once a patient has got a biopsy report in his hand, I'm very sure he will get his surgery done within no time.
Correct.
But if you just say, if you have doubt, एक काम करो भाई, तुम सिविल चले जाओ, शायद तुमको कैंसर हो सकता है. The moment you talk in that slang language, first patient will lose confidence in you. कि कैसा डॉक्टर है, इसको क्या पता कैंसर के बारे में, मेरे को ऐसे ही बोल दिया कैंसर है. Never ever mention that you have a cancer until unless you have a hard copy report of the cancer on your table.
Okay.
Never ever mention that. If you mention that, patient takes a negative, patient gets a negative impact. Patient gets a negative impact. So it is very important that we should get training into these dental professionals into biopsy taking, and what are the imaging can be used. If you have a doubt, get themselves a OPG, a sonography, a CT scan, when and what is required, that we are going to teach. And third thing comes the dental oncology. So there are 3 modules. I'm going to talk about dental oncology in the next after I answer your question.
Yes.
So we have got 3 modules. We have got faculty across India. We have got 4 directors and 8 faculty. Our first batch is already completed. Our second batch is running. Every month we have one batch where we are training. We are giving the certificate of you should be appreciated as oral cancer screening consultant, and that will be endorsed by the Gujarat University. So this certificate will also carry a weightage of you being certified by university. So a patient, when their certificate is put on a wall, a patient sees that yes, you have got some certification to treat, to take a biopsy, to guide a patient for the right treatment.
Correct.
Next thing is we also have the next planned up projects. Once this is one of the part educate where we are training people and then we are going to take them along. It's not the end. Ayushi, it is not like the general courses of implantology कि आप 50,000 रुपए दो, ये 2 implant लो, फिर आप जानो, आपका काम जाने. No, it is not like that. Our intentions are not to earn money. God has given us enough money to live a good life. Our intention is not to rob money, get money from our colleagues. It is just they should value the money which they are paying it. We have a small fees of 2,000 rupees for students and 4,500 for delegates. Okay. So that fees is for they should value the course, that is what we are taking it.
Yes.
Once they are going to get trained, we are going to take them along in many of our projects which our foundation is planning in coming future. It will be a lifelong attachment once anyone get attached through these ECAN programs. It will be definitely, we are going to give them support, whatever best I can do as my colleague, my friend, my family, we are going to provide them the whole support 24/7. So that is about the ECAN module. Anyone interested, they can log into our website of Asian Head and Neck Cancer Foundation. They can get information. They can get connected to Ayushi also. Ayushi is connected to Dr. Bhakti, who is our project manager.
Yes.
So I think anyone have any doubts, will definitely make it very clear.
No, this is very commendable, sir. Much appreciated. So because this is something that every dental graduate looks forward to. Learning about basic skills which we are not being trained towards in our graduation, and these are skills that we need to know to get better with our treatment plans and with treating our patients. This is amazing, sir. So yes,
right.
If you can, explain a bit, as you mentioned, explaining a bit on dental oncology, that will be great.
Yeah. So now dental oncology is something which has been practiced in the Western countries.
Yes.
So as you said, when I went for my fellowship program at Memorial Sloan Kettering Cancer Center, which is world best cancer center in today's date. It's in New York. So there they have got a dental oncology separate department. So I had been, that was in my mind since last 8-7 years, that what is this dental oncology, and how we should develop the same protocols of dental oncology in countries like us. Fortunately, one of my colleague, my junior, my close friend, she has pursued a dental oncology, Dr. Anu Singh. She as a dental graduate, she is a dental graduate, not a postgraduate.
Okay.
Right now, she is based in US. She is with the same institute, Memorial Sloan Kettering, pursuing her fellowship in dental oncology.
Okay.
So, dental oncology, what is this dental oncology? Now, every cancer patient, as I said, goes through many dental issues. When it comes to oral cancer, I think everything revolves, every complaint of the patient revolves around this.
Yes. Yes.
Unfortunately, when a patient is being operated, after operation, if any patient goes to operating surgeon, sab ye takleef ho rahi hai, he will send it to radiation oncologist will send it to dental surgeon to jahan se aapne operation kara wahin jao. Patient becomes a football.
Yes.
Nobody address the complaint of these patients. Now, what complaints they carry? They carry a complaint of trismus. They carry a complaint of poor oral hygiene. They carry a complaint of sharp tooth. They carry a complaint of inability to chew. They carry a complaint of inability to talk. They carry a complaint of not able to chew the food because there's no teeth there. He has to be on liquid diet. There are many quality of life issues associated with the patients after cancer surgery. Cancer surgery also, before cancer surgery, every patient, standard, if we go with the protocol, they should undergo a oral prophylaxis. It is very mandatory. But in countries like us, every patient is taken as a granted. Nobody undergoes a scaling. Next, every patient undergoing radiotherapy should undergo scaling along with that fluoride application. Now, why fluoride application? You might have read in your third year Burkitt's or whatever book we had, there's something called as radiation caries. The radiation caries has to be prevented with the fluoride application. Again, unfortunately, no patient undergoes these kind of treatment. Why? Now I ask you, Aishi, why these patients do not undergo these kind of treatment, fluoride treatment, to prevent their radiation caries? Two reasons. Number one reason, what I see, it can be my personal opinion, not a generalized opinion. What I see is because our people has not shown to the surgical colleagues that your fluoride application will prevent radiation caries. Because we are also not bothered. चलो ठीक है तुमको रेडिएशन कराना जो कराना कराओ मेरा क्या लेना देना. But no, it's our professional responsibility. We need to understand it's a professional responsibility that we should offer them a simple fluoride application which cost, and you are not doing a social service, you are earning out of it.
Yes.
If you do a fluoride application, you will earn 5,000, 10,000, whatever is your charges.
Yes.
So you are earning also, but still you are not doing it. Patient, you are not doing for charity.
Correct.
Secondly, the surgeon have not appreciated your effort. कि यार हाँ मैं ये कराता हूँ, ये इन्होंने मुझे ऐसा बोला है तो इससे पेशेंट को फायदा होगा. So it is from the loose ends are from both the sides.
Correct. Correct.
We cannot change their mindset, but we can change our mindset.
Yes.
Many issues. This is the fluoride application is just part of it. Then you have patient. Usually they will have trismus. You will have difficulty to treat any dental issues in oral cavity. You need to give patients physiotherapy to decrease the trismus. The important aspect is ORN, that is osteoradionecrosis. After radiation, these patient develops ORN. Now, no dentist know कि ये ORN हो गया तो इसका क्या management है, how we should be doing it, when you should extract a tooth, when you should not extract a tooth. So the dental oncology teaches you all these small things, but again, it's with dedication. If you train yourself into this field of dental oncology means addressing the issues of the dental and oral health issues of patients undergoing oral cancer treatment. One more important thing I would want to mention here is it's not oral cancer patient, they have oral hygiene issues. Those patients who are undergoing chemotherapy for generalized cancers, for general cancers. When I talk about general cancers, it can be blood cancer, lymphoma, it can be ovarian, it can be breast cancers. All these patients undergoing chemotherapy, they have got oral issues, and that has to be managed by a dental oncologist. Dental oncology will open up the avenues as a subspecialty of dentistry for the future generation. We are taking the lead. We are trying to start off the dental oncology, at least a mindset we need to influence. Yes, there is something called a dental oncology.
Correct.
And we can contribute into dental oncology. Once we have enough centers to get people trained in dental oncology, we would like that every cancer hospital across India should have a dental oncology department in their hospital.
Yes.
That will open up the job opportunities for hundreds of dental surgeons. But that requires, again, it requires a patience, it requires a dedication, it requires a patience. Important is once we just finish our graduation or post graduation, the word patience is being lost.
Yes.
सबको ऐसा लगता है कितना जल्दी कुछ कर जाऊं मैं because मैंने बहुत कुछ पढ़ लिया है. No, it's not like that. You need to develop yourself into a field and make difference into the people life as your professional and also a bit of social responsibility.
So, so rightly said, sir. And the idea of what you mentioned is that the dental oncologist in every hospital and oncology center will be amazing to think of. It can actually help each cancer patient in the country to have a better treatment completely. So now
Right.
understanding this is, understanding your views is really nice, sir. So now coming back to the question, as you mentioned that oral cancers and dental oncology has been into the West since years now. And you also have been there to get a bit of training to understand their systems, their way of treating patients. How did you do that? How did you figure this out? Going internationally, applying papers there. How does it happen?
Okay, it's all about mentorship. If
Okay.
you have a good mentor, things will go smoothly. See, Western people are very receptive. If they go through the right channel, they will try to teach you. So for me, as I said, I had my mentors who has always guided me into the right path. When I was at Patna, one of my mentor, Dr. Dave, he has guided me to go to US, spend some time in the Sloan Kettering Center, and see their working pattern. We should know what is best, so that you can strive for getting that. It's not what you are seeing best at this place.
Yes.
You should see what is best at international level. So you try to develop the same thing, reciprocate the same thing at your own level whenever you are back, whenever the things are in your favor or in your path, your direction. So it is the contribution of mentors. If somebody wants to visit US, I tell you, if somebody wants to visit US, I think I can guide you anyone anytime in any country. Now it's like हमने बहुत हाथ पैर मारे थे, हमने सब बहुत टेढ़े रास्ते गए, ऐसे सब रास्तों से हमने सीखा है. बट नाउ वी नो कैसे, अब नाउ वी लुक बैक एंड सी. सो एनीवन इंटरेस्टेड कि मुझे डेंटल ऑन्कोलॉजी सीखने यूएस जाना है, आई एम देयर टू गाइड यू. आप मेरे को मुझे ये this I want to learn from this person in UK, I'm there to guide you, because I have been to across the globe. I had been to UK, I had been to Australia, I had been to Taiwan, I had been to Germany, I had been to the Sloan Kettering. So with so much of my personal and experience, I could now gain how to place people if they're interested at right place. I
Okay.
can be the person who can guide you. आपको जिधर किसको कहीं पे भी जाना है, you can connect me, and I will guide you proper guidance, and I can give you a reference letter.
Hmm.
Wherever you go outside, what they need is a reference, and
Yes.
reference letter decides your application will be accepted or not.
Correct.
So thankfully, and I'm thankful to my my God and my parents that at least I have got that much, that I my reference letter will work for you wherever you want to go.
So actually, we had one viewer who wants to go to Germany. So he wanted to figure out how is dentistry there in Germany because you have done your fellowship there. So just a brief, if you can mention about that specific place.
Okay, so again, now the question is oriented towards dentistry. I
Yes.
will not be able to comment on dentistry,
Okay.
but yes, if somebody wants to get training in dental oncology
Hmm.
as a graduate, I
Hmm.
can help them. I
Hmm.
have not practiced dentistry, frankly, anytime. The moment I finished my graduation, I did my masters. I went into surgery.
Hmm.
So I have not practiced dentistry per se, and I have not saw the avenues as a dentist in abroad.
Hmm.
But what I can mention about is, if you want to pursue dental oncology,
Hmm.
I can help you. I can guide you through. But probably, I'm sorry, not as the dental professionals. I mean, just as a dentistry, I will not be able to guide you.
Okay, okay, great, great. So that's fine. So that's completely fine. So now understanding your journey of going international. So now coming back to the final point, something from your end for the dentists and the postgraduates who want to pursue dental oncology. What is your suggestion to them? How you know how should they make up their mind to get into the branch and anything from your end for them?
Okay. So first, I would like to invite you people to be part of Educan program. Whosoever is listening to us will definitely guide you. The Educan will give you an open mindset of what is the journey ahead. So
Hmm.
as a graduate, the Educan will definitely help you because this program is specifically meant for graduate professionals.
Hmm.
When it comes to maxillofacial surgeons, I
Hmm.
think you can connect to me anytime. You can I can talk to you from whichever place you are.
Hmm.
I'll try to arrange an observership program
Okay.
anywhere in India, whether you are in Himachal Pradesh, whether you are in Northeast, whether you're in Bangalore. I can arrange for observership at any place across India. That I can promise you.
Hmm.
Once you start your observership,
Hmm.
complete your observership, then I will guide you for fellowship programs.
Hmm.
Once you have done with the fellowship program, I can guide you for how to start your practice and work as as a head neck cancer surgeon. So I can be of your help at every stepping stone. For dental professionals, yes, you also can connect to us individually if you are not registered with Educan, and if you want some more guidance about it, because still the dental oncology it's in the embryonic stage in countries like us. So
Yes.
we are trying to develop, probably in coming, if the things are not disturbed by corona, we had a plan to organize a dental oncology conference somewhere in December,
Hmm.
but it has been postponed because of the corona. And we are going to reschedule our program, wherein the faculty will be from Memorial Sloan Kettering Cancer Center. People will be coming, and it will be a platform for everyone to interact, understand the dental oncology in that 2 days program.
Okay. Okay. Great. Great. It's very interesting to know, sir. So now understanding about this, understanding about you and your journey. What is it that keeps you motivated always to stay positive, to educate everybody, as well as to grow yourself every day? What is it that is a mantra of your life?
Passion.
Passion. Okay.
It's surgery is, if you take the surgery, I mean, surgery, whenever we say, it's only the passion which drives you. It takes a lot of hard effort to learn, but I think that passion is the driving force that keeps you get into the stick onto the field and learn and learn.
Hmm.
So I think if you're passionate about your work, everything follows through.
Correct. Correct. Correctly said, sir. So lastly, I want to ask one thing, how is your life? How is your schedule every day? As a surgeon, as an oral facial, now as an head and neck oncologist, as well as an educator also, how do you plan your day? How is your day if somebody wants to get into dental oncology and wants to go deep? What is it that person can expect as a day schedule? How does it go?
Okay, so our day schedule is, it's I don't know how much people will be able to understand, but we operate around 16, sometimes 16 hours, but minimum is we do 2 free flap cases in a day, and it's almost 10 to 12 hours every day we are spending in operation theater. And definitely we are the weekends we are spending for the Asian Head Neck Cancer Foundation. 2 days I'm giving off for my foundation, wherein we are organizing camps. We give our energy into developing different projects, developing the programs like educan. So 2 days I spent for Asian Head Neck Cancer Foundation, and 5 days we operate 10 to 12 hours, almost 10 to 12 hours in operation theater. Our OPDs are being seen in between the operation theater.
Okay.
I am not reachable to phone many a times. Many a times, my assistant or the people around me will be attending the call. What I would request is, you please send me an SMS if you want to connect to me, because again, WhatsApp and all, I'm not very much onto the screen. I hardly see the WhatsApp. WhatsApp is seen from my office only. So if you want to connect me, please send a SMS, because SMS is one thing which whenever I'm out of surgery, I just see the SMS. And if there's a missed call, or if the call is not been attended, leave an SMS. I will revert back the call for sure. And schedule is it depends on how you want to keep yourself busy. But yes, I am thankful to God that we are getting so much of work. You won't believe that we are doing the amount of work. In last 15 days we had almost done 21 free flap surgeries, which is itself is a landmark, or which is the highest across Gujarat. So we are doing amazing work. If somebody is from Gujarat, from Ahmedabad, if they want to come as an observer, please come, spend a day with us. You will realize what we are doing it, and you will also enjoy it, our company.
Great.
And
So
it will be our pleasure to have you.
this is so exciting and so nice to know. I'm sure there will be so many students who might be interested to connect with you and to understand this. I will definitely let Dr. Bhakti also know whoever is interested into educon program. This is very, very interesting. Everybody who are listening to this talk, make sure to understand about dental oncology, something that I'm sure Dr. Shakti has influenced so well everybody. I'm also so impressed by this. So do
Thank
connect
you.
with him, do connect with understand about the education program. It is very minimally priced, and if it can help you to grow in basic skills of medicine and dentistry, why not? So this is something that every dentist should know to understand, because this is a branch of dentistry which is still growing, which is still not saturated. So, and we have people like Dr. Shakti who is guiding us with it. So do understand, get proper knowledge, and if you feel you can become a surgeon, so the actually doors are open for you. Thank you so much, Dr. Shakti, for
Thank you, Aishi, for inviting.
it was purely amazing to discuss this with you. It was really nice to understand this branch, and thank you so much, sir, for taking out time. Thank you
Thank
so
you. Thank you.
much.
Bye bye, all. Thank you. Take care.
Yes, thank
Yeah.
you so much, everyone. Bye bye. Do share it with your friends and colleagues. I'm sure this will be of great help for them. Also, do follow us on our Instagram and YouTube channels as well. Thank you so much, everyone, for
Thank you
joining.
all. Thank you all.
Thank you, Dr. Shakti. Bye bye.